knowing that we have that supply coming in just helps us continue to provide care, and also gives us a little bit of, of peace of mind going into flu season and into these winter months when we're projected to see, record numbers of COVID cases.
Coronavirus cases are setting records across the country, and local tribes are working against a federal deadline to get mask-making facilities built before the end of the year. It's a challenge our local tribes, including the country's largest, the Cherokee Nation, are facing right now in rural Oklahoma. Tonight, in our series, Native America, The Road to Recovery, Tony Russell shows us how the Cherokee Nation is making sure it's prepared for this next wave of the pandemic with a new facility being built right in our backyard.
On Oklahoma's eastern border in Stillwell, the Cherokee Nation is turning this old Walmart into a medical-grade PPE facility. The entire building is getting retrofitted so it can make approved N95 masks right in the heart of the nation.
It gives us a little bit of peace of mind knowing that my nurses who've been on the front line through all of this are going to have what they need to keep them safe.
Dr. Emma Harp, a Stillwell native and a Cherokee citizen herself, has seen 3,900 coronavirus cases come through the tribe's health system since March. What was that like in your facility?
Well, at Cherokee Nation, we have been really fortunate to have had adequate supplies during the entire pandemic. There's a lot of people who have not been so fortunate. We early on were really precautious about, access to the N95 masks, especially. That was a hot subject. As a facility, we were engaged in working with our departments to be sure that we did calculations. How much do we have? Let's secure these, make sure that we're not wasteful, and that we're able to provide our staff with the PPE that they need.
But the tribe isn't taking any chances on having enough in the future. It will be making its own masks from this warehouse by the end of 2020. The Cherokee Nation spans 14 counties here in eastern Oklahoma, and so the tribe is ramping up its PPE efforts. 2 facilities are going to help with the mask-making materials and the storage. And on top of it, testing sites like this one here in Stillwell. This is how the Cherokee Nation is rolling out its coronavirus response plan after it received more than $400 million in CARES Act relief dollars.
This is all based on need. We're responding to the need.
Todd Enlow, the tribe's chief of staff, is working to make sure a mask shortage never hits the nation like it did for so many communities in the spring.
The other thing that we struggled with was actually gaining access to the PPE and materials that we needed to protect our healthcare workers and our employees and our citizens abroad. So realizing that was a problem and a challenge inside the United States supply chain, we felt that we could help supplement that by providing PPE or mask making here in Stillwell.
The virus has hit the tribe hard. Oklahoma's first reported coronavirus death back in March was a Cherokee citizen. Keeping Cherokee citizens safe from the deadly virus is a top priority for Chief Chuck Hoskin Jr. Even for the country's largest tribe, getting help from the federal government had its challenges.
We also had to fight for those dollars. So even though Congress approved the CARES Act, we had to fight for those dollars to get out the door from the Treasury Department to the Cherokee Nation. We even had to engage in some litigation when there was some funds that were frankly diverted to purposes they shouldn't have been diverted to. We ultimately were successful in that. All of that put us behind in terms of getting dollars and getting them out to the community. So not enough dollars, not dollars quick enough. And yet with what we had, we've done better, I think, than anyone.
Fighting the coronavirus is also about preserving their culture and native speakers after losing several elders to the virus.
The concerning thing for me is that it is far from over. In fact, the spread is more dangerous now than it's been in a while. And we've got to do everything we can to remind people of this danger. And sometimes using those personal stories helps because we're going to lose more people if we're not careful.
Next week, we're heading to Shawnee, where the Citizen Potawatomi tribe is providing individual assistance to its citizens, including helping one business owner stay open in Stillwell, covering Native America, the road to recovery. I'm Tony Russell, 2 Works for You. Is the CARES Act funding working for you? If you're an enrolled member of a Native tribe in our area, let us know by emailing us at nativeamericarecovery@kjrh.com.